Good day, fellow learners. Once again, this is your mentor, your fact check buddy Ray Gapuz, joining you for another teaching and learning session. This time around for our pointers session number 14. Now, you are preparing for your next generation NCLEX RN. If you may want a technologically aided preparation in a technologically enhanced learning environment, please consider joining our hundreds and thousands of passers from around the world. Give us a text or call 0906-201-9383 or send us an email info@ragapusreview.com. And let's learn from an experience of a nurse from our pool of passers recently. Here's the story. Okay, fellow learners, this is the story of Maria Alisa Reblora, USRN, in the state of Texas, and she passed the next generation NCLEX RN last May 19, 2023. So let's get into her story and let's find out how she passed her test. So this is what she actually sent me after her exam. So that was on May 21, 7:12 a.m. That's a day after. Dear Sir Ray, how are you? I'm one of your students from the NCLEX RN Quick Fix held last April and May. So Quick Fix is a 3-day, 24 hours divided in 8-hour session for 3 sessions in 3 days. And that's what we do to give each examinee a sense of focus. I was one of 2 students you mentioned last Thursday at Gapuz. You mentored last Thursday at Gapuz office. I took my exam last Friday and was still in shock, so I wasn't able to send you a message afterwards. I thought about writing to you after I received at least my quick result, but now I just realized the cons of taking the exam on a Friday. I have to wait for a few more days for the quick result. Anyway, my friend who is a Gapuz baby convinced me to send you a message the soonest possible time. I would like to let you know that I am so grateful for your mentorship. Almost everything you discuss in our quick fix sessions appeared on my exam. I'm having goosebumps. Praise God. The last pointers you gave us last Thursday, I studied it all as much as I could during the wee hours in the morning because I was too nervous to sleep. Most of it appeared in my exam. Once again, let's read that. Most of it appeared in my exam. I was cramming, but it was a good cramming, I guess. Totoo pala, in English, it's really true. Naririnig ko boses mo while I was taking the exam. It's as if I'm hearing voice while I was taking the exam. I was in the exam for like 10 minutes and I was on my 8th item when I heard what you always tell us, go slow. And I did. I was so nervous that my hands were cold and trembling. I took deep breaths and exhaled, firstly breathing style, laughing out loud. I slowed down my pace. I ended my exam at 85 items. My PC shut off. I almost forgot that there was a survey after, so I hastily raised my hand when I realized this. My fear was the traditional questions and the dreaded SATA. Funny thing is that my first question was a SATA. I think I get a lot of SATA, like every 7 or 8 items it is there. I also get a lot of case studies, some 6 items, while others are standalone. I answered it all carefully while following your test-taking strategies. I do hope I pass. I will hang on while waiting. Wow. And let's find out if she passed through the next email, which I'm going to read. And this is the second part of Elisa's email to me. And this came actually a day after we were just exchanging emails. And she said, just an update to rate. I passed. I just received my quick results this morning. I am forever grateful to you and to all our mentors. Please extend my thanks to all of your staff for also for accommodating us. I really love how you handled our review sessions. I learned a lot from all of you. I'm recommending your review center to all my colleagues. Mabuhay ka, Sir Ray. You are such an inspiration to me. God bless you, sir. Forever thankful, Alisa, USRN 2023. And Alisa is one of the hundreds and thousands of many nurses worldwide who passed the NCLEX RN next generation through our course shell. And of course, the Ray Gapuz system. So be a USRN, text or call 0906-201-9383 or send us an email at info@ragapusreview.com. See you at the center. I just hope you learned from that very inspirational story. Now, here we go. The first question that you have to ask yourself is, what will I study? Make sure you're getting the topics that you need to focus on from someone who is an expert, not the false prophets of the NCLEX NGN type questions. Okay? There are a lot of false prophets out there. Here, our system is based on empirical and research methods. Okay, so here we go. So the first topic that I'd like to highlight would be dehydration. And when you study the concept of dehydration, make sure that you have to compare who should be your priority. Is it a dehydrated 80-year-old or a dehydrated 8-month-old? Here's the answer to that question. Okay, remember, IV fluids help maintain body fluid balance, and the average daily fluid intake in an adult is 1,500 to 1,700 ml. Obtaining the body weight is the most objective way of monitoring body fluids. And take note, here we go, dehydration is more severe in young patients. Why? Because their body weight is more dependent on more fluids than the adult. So which means the percentage of water in the human body decreases with age. Look at this. The fetus, their body weight is dependent 100% on water. The baby at birth, 80% of the body weight is dependent on water. Normal adult, 70% of the body weight depends on water. And in the elderly, 50% of their body weight depends on water. So therefore, if you're comparing dehydration in a baby and dehydration in an elderly, it is more harmful in the baby because the baby's body weight depends more, approximately 80% of water in the body than that of the elderly, in which the body weight depends on the 50% amount of water in their body. So dehydration will have more severe effects in the infant than the elderly. Okay? So the characteristics of the skin depends on the degree of dehydration. If less than 5%, there's going to be 5% loss. The skin will be pale. Then it's one to touch. For 10% loss, very pale to cool, and then mottled. For 15% fluid loss, mottled to cyanotic and cool. Now take note that in the first 2 weeks after birth, the baby would usually lose normally 10% of their body weight, and they will have to regain it within the next 2 weeks. So at approximately 1 month after birth, their body weight is the same as their birth weight. Okay, now allergy. I'd like to focus on latex allergy. Who are more at risk to latex allergy? Clients with multiple surgeries, like clients who have undergone surgeries 5, 6, 7, or 8 times. Healthcare providers because of frequent exposure to latex. Okay, babies with spina bifida or meningocele or myelomeningocele, because these babies would have to undergo multiple surgeries as they grow up, because more often than not, myelomeningocele after the closure could potentially lead to hydrocephalus. And after hydrocephalus, usually they will need to be operated on for the insertion of ventricular peritoneal shunt. So that will make them more at risk to latex exposure in the future. Family history, and then of course, multiple exposure to latex. Now, what are the different elements that a client with latex allergy should avoid? Okay, clients with latex allergy should avoid avocado, banana, balloons, chestnuts, chewing gums, condoms, not unless it's your condoms or chewing gums, kiwi fruit, pacifiers, pineapple, and of course strawberries. Now, pay particular attention to the fact that dragon fruit is usually not associated with latex allergy. It has a different allergic reaction, not necessarily related to latex. Okay? And of course, the third topic would be digoxin overdose. Now remember, the first line of treatment for digoxin toxicity is repeated dosing of activated charcoal to decrease the absorption. It's usually best given within the first 6 to 8 hours after ingestion. In acute digoxin toxicity, digibind is given as follows. Initial 5 vials of hemodynamically stable clients for hemodynamically stable clients, but 10 vials if the client is unstable. And then repeat doses of 5 ampules every 30 minutes until the reversal of digoxin toxicity is achieved. Now, usually, what causes digoxin toxicity? If the patient forgets about the dosing, for example, if the patient's dose could be half tablet before bedtime, and then the patient, instead of taking half tablet, took one whole tablet. So you will have to first assess the patient. The common manifestation of digoxin toxicity should be unstable pulse rate that usually goes down below 60, and then there's going to be persistent anorexia, nausea, and vomiting. In that case, instruct the patient not to take additional dose of the medication and consult with a physician right away. So that's the most important thing if the patient has taken double than that of the dose that has been ordered by the physician. Okay, so the second important thing is use technology to study the next generation. NCLEX is difficult to navigate if you're not familiar how to navigate the technology enhanced interface of the examination. So here at RA Gapuz, we have tools that have been published by world-class publishers. And of course, we have learning tools that are addresses the different subjects on the NCLEX RN. So pay particular attention to the fact that we're now offering the RA Gapuz Review System course shells. And for you to find out how you can avail this for free, send us a message through email or through our text line. And wait for the grand raffle for the free access to our learning tools on June 25. Register early. And of course, the most important thing when you are preparing for the test is you have to be in a conducive environment that should keep your focus. Here at the Ray Gapuz system, the second floor of the Ray Gapuz building in UN Avenue, we have our NCLEX simulation room that simulates the entire NCLEX RN experience, and of course, our very conducive face-to-face classes during quick fix sessions. So join us, send us a message, and I'll see you in our next video. But before we end this session, may I invite you to join me in the next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. The fee starts at $3,499. You can choose to have either weekday classes, either AM only or PM only, or weekend classes, also either AM only or PM only. Give us a call at 0906-201-9383. So the NCLEX RN Flex has several components, like you can choose live face-to-face class, live virtual classes, on-demand unlimited video recorded lessons, QBank, and 3 books, or next generation strategies and sample questions with me, okay? And of course, quick fix sessions, okay? So I'll see you in our next video. Once again, this is your mentor, your fact check buddy Ray Gapuz saying, a functional concept a day keeps your NCLEX RN fears away. Take care.